From the University of California, Irvine, this is UCI Minds Spotlight on Care, the podcast where we share stories, experiences, tips, and advice on caring for loved ones affected by Alzheimer's and other dementias.
Hello and welcome to Spotlight on Care. I'm Virginia Nave and I'm here with my co-host Steve O'Leary. Today's topic on Alzheimer's caregiving is in-home caregiving. We are going to talk about what to do and how to find help if you're caretaking your loved one at home. Before I introduce our guest, Steve, how long did you keep your wife Patty at home, and how and why did you make the decision to place her in a community? What things did you consider?
Well, Virginia, I think that maybe a little insight on the process of finding in-home care, which is certainly a challenging time. I got some good advice from some other people that the biggest hurdle was getting them to accept it. And it turned out after interviewing a few different companies, one of the people I spoke to said, well, we're not going to just show up. We're going to come there and have a get acquainted meeting. And I think that helped a great deal with Patty's acceptance, not only of the idea, but also of the person who was going to be the caregiver at home. So that worked. The decision about moving her from in-home care to a community care was really a practical decision and a decision about her care. I was still working at the time. I was dealing with my own disease that I had been diagnosed with, pretty severe prostate cancer. So I just felt like I couldn't provide the level of care that I was providing before. And when I looked around, I saw places with music and entertainment and places our dog could go with her. And it was just like, well, I think they can do a better job. Not an easy decision, the hardest decision I've ever made.
Yes, it's a tough decision, but it's personal for everybody. We all have different circumstances. My mom's home was almost an hour away from my home, and I really felt like Mom was at the point where she was unsafe. And I was too far away to keep a good eye on her. I was still raising two kids and driving around like a maniac, like moms do. And so long story short, I placed her in assisted living near my home, and that worked for us. Whether or not you keep your loved one in their home is a personal, and it is a tough decision. Our guest today is Mark Wilson. Early on in his mom's progression with dementia, he decided that there must be a way to keep his mom in her home. That is what she wanted. That is not an easy decision, but he was determined to figure it out. Welcome, Mark. We're glad that you're here.
Thank you, Virginia and Steve. Glad to be here.
Great to have you here.
Thank you so much.
First of all, before we get into all the details, tell us a little bit about your mom. What was she like before she was?
She was amazing. I mean, she was had a great personality, was fun, smart. She was a teacher, a kindergarten teacher forever, and an amazing mom. I mean, I'll tell you a quick story about her kindergarten. After she retired, before dementia set in, she would be driving around and walking around with us and going shopping, and people would come out of the woodwork to say, Mrs. Wilson, and just thank her for taking care of her kids, and their kids are successful because of you.
Yeah.
It was like I'd be beaming, from ear to ear with just, pride. And she was like the best teacher ever. And Mom, she would care about us and teach us and let us develop, make mistakes. I mean, she was like, I can't imagine a better mom. Maybe somewhere in Nepal there might be a better mom, but nobody I've ever met. So,
she sounds like a great person.
She's awesome. Yeah.
Great person, great mom, great teacher. Yeah. So you were telling me right around 2011, you were starting to notice some things that weren't quite right. Tell us about that.
Yeah, let's see. The beginning, well, I was working at the time, and I was an HR executive at Taco Bell and traveling all the time and busy like any other, kind of leader. And I wasn't really paying attention, but my sister kept telling me, she was closer to my mom and lived in the area, that she was starting to forget things and just not herself. And I was kind of, we talked about denial. I was in denial. It's like, oh, no, she's okay. Marina's my sister's name. She's okay. And she said, no, I think we should get her checked out. Anyway, was pushed me, and we took her to UCI Mind, and thank God we did, because they had diagnosed Alzheimer's and to get on the medication. So we got on some medication right away, and I think it definitely extended her, her health and her slowed down her progression. But that was kind of in the beginning, 2011, 12, she was pretty functional and pretty good, but just not herself, but the medicine helped a little bit.
Mm-hmm, mm-hmm. So you were mentioning after a few years in, maybe 2015, the symptoms were starting to get more clearly defined as Alzheimer's.
Yeah, well, it started declining in 2013, 14, like that. Mm-hmm. And she started just, the speech was kind of beginning to, be difficult for her. And the forgetting was getting worse. And my sister was trying to help out. And I just, realized that, I knew about the disease, having read about it and talked to the, people at UCI. And I thought, I just need to, I need to be with her at home. And Taco Bell was amazing. They gave me a wonderful early retirement package, and I said, I'm going to just take care of her at home. And so kind of the end of 13, I took an early retirement and to take care of her. And it slowly progressed, and I was doing pretty well, taking care of her pretty much by myself, with help from my sister, 2013, 14. And then by 2015, the speech was very bad, and she needed, watching all the time and in 24-hour kind of care. She was still pretty functional, but it was bad, and I realized I needed help because I just couldn't do it by myself, and it was just too hard, even being at home. So then I started kind of researching, help.
I know that you did a lot of research. We were talking about that. Before you tell us exactly what you did, tell us the difference between an agency and a registry.
Yeah. Well, I started out using agencies, and that's what I did. Later on, I had some private help. But agency is how I started. I know I never used a registry, but I know the difference is pretty fundamental. The agencies are basically hire employees. The caregivers are employees, which means that they pay them, they manage their insurance, they make sure they're licensed, trained, and all that. A registry, the way I understand it, it's more like a network. You sort of go to the registry, and you find a caregiver, and then you go through the process and you hire them. So it's pretty different. And I used an agency primarily because I and thank God I did this. And as a side note, I suggest this. I had a long-term care insurance policy that required that I use an agency with licensed people and all that. And plus, I had never done any kind of caregiving hiring ever. I didn't know anything about it. And so I thought agency would help me because they really know a lot about it. And they know a lot about who to hire and what to do. And I'm so glad I did. So anyway, I started just researching agencies, and the criteria was pretty clear. Did the person have the agency have some experience with Alzheimer's? And then I also thought it was important because I knew I wanted a sort of baby step. I didn't want to have, some of the agencies asked for a bigger commitment, like the shifts have to be 8 hours and a longer term thing. And I wanted to just sort of try this and see how it would work. And so I picked an agency that had 4 hours shifts and pretty good experience with Alzheimer's, and that's how I got started.
Did you get to interview the person, or did they just send somebody?
No. They basically they did anyway. I wanted to, but what I prefer is they'd narrow down the list. They give me 2 or 3 candidates, and then I'd interview them. It was still kind of new, and I was a little bit awkward. I didn't want them to be interviewing at home because, I wanted to sort of ease my mom into it. So I would meet at a Starbucks. I'd talk to the person, get a feel for them. And then I would give them a try, and they'd have a shift. I'd try to do a short shift, like a 4-hour shift, and just let them sort of be on the job and see how it went.
Okay, so you could have coffee with them first before they even met your mom.
Correct.
So you had a feel for whether or not
just
you
see
might
if I
like
liked
this
them,
person.
and they, had experience. But as a former HR executive, did a lot of interviewing, and I know it's not an exact science. So I thought the only way to really know is, give them a try.
Yeah,
so.
yeah. I remember when Mom was still at home and I couldn't supervise all the time, and I called an agency and they sent somebody there, and I, of course, met the person, but Mom couldn't understand why there was now this woman in her house sitting on her sofa. And I said, well, you could use some help shopping and with housework. And she goes, I can do all that. And it was not an easy situation. Okay, so fast forward a little bit. How did your mom feel about having someone there with her?
So that's a great question. In the beginning, what I tried to do is I tried to be there with the caregiver and kind of think of it as a partnership. So I think that helped a little bit. So I was there for a couple of purposes. One is to evaluate, see if the caregiver was good, and at the same time sort of be a little bit of a helper, And so if the caregiver was doing well, and then I would back off, and if the caregiver was struggling, I would be more intrusive and be there. And so what I observed, the two big buckets that I was looking for, and I figured this out pretty soon, was one is safety, because my mom was starting to have a little bit of trouble walking. She still could walk, but she started using a walker, and that kind of thing. And so safety was number one, and then fun, is number two. Could they have a good connection? Did they enjoy each other? Was there something kind of, magic there? And you could tell that. It was remarkable because the caregivers that sort of had it, both the safety and the connection, you knew fairly fast. And the ones that didn't, either one or the other, you could tell, sometimes not quite in one shift, 4-hour shift, but by the second shift, you knew if there was, that connection.
So you actually had to fire a few people?
Well, good news. One of the good things about an agency is they do the firing. Having fired and hired a lot of people in HR, it's not fun. so all you do is basically tell the agency, I don't think it's a fit, and that's all you have to do. So it's pretty easy. At that point, there's no relationship, so that's another advantage of using an agency. They do the dirty work, if you will.
Well, I saw your list of requirements, and it was 5 pages long, Mark. I did notice some things that I'm not sure I would have thought of, but they're very important. Rules at mealtime, choking and swallowing, it becomes an issue. Bathroom habits. I understand men get UTIs, but women get them very often. And they can't tell you what's wrong, and then they turn upside down. Medication and meal management. They're all really important topics. The caregiver has to really have a grip.
Well, it's these weren't requirements that I would place in the interview process. These were things that once, I felt like it was safe and they had a connection, then I sort of laid these on them. And I evolved, they evolved over time. I didn't sort of have this on the front end, but as I learned, and they're very tailored to my mom. So your list will be different, but they're tailored in the sense that, my mom had trouble walking, and transitioning from, bathroom, standing and all this. And so that was really important because, she never fell, but people that I knew had loved ones that fell, and it was like very bad because they'd be in the hospital, and the hospital is the end of it, with a lot of people. So safety was one. So walking was big, and it's funny because caregivers, even good caregivers, kind of have a lapse. They'll like assume that you can walk, or they don't want to be too intrusive or too hands-on. So I wanted to give them permission. So the rule was anytime she's in a standing position, you want 2 hands on her. Okay, even if she's walking with a walker and looks safe, have your hands on her, because that's when there's a fall. If you kind of step back and you assume, that things are okay. So that's really important. Swallowing and choking and all that was kind of got worse over time. As the disease progressed, swallowing and chewing and eating was harder. Till the very end, she ate by herself, which was great. But I was worried that sometimes caregivers would feed her too fast, or not let her chew things thoroughly. And so I had, again, this is very, prescriptive, but it's, I said, okay, make sure make sure she swallows before you give her more food. And how do you know that? You watch your throat. I mean, and things like that. So it's and they did, people, once they have some guidelines and some expectations, people were not offended. They actually appreciate it, for the most part, this kind of level of specificity. I had a boss at Taco Bell would say, keep things simple, duckies and goats, so I'm trying to be very, very, very clear, very simple. And they appreciated that. And it gave them something to, and it also gave me something that if there was a problem, it's like I could, sit down with them and have the list. Okay, this is the one here. You got to do this a little bit better. So it was very helpful.
They had to know you had rules.
Yeah, and the cleaning and UTI, that's just like basic, because my mom used to get a lot of urinary tract infections, and that's why it was tailored to her. And the pills and the food, the supplements, I was kind of big. And one of the reasons I think she was doing so well for so long was I kind of looked at supplements that were important. The doctors, don't like, natural stuff, but I think it helped quite a bit. And I do research on those and give her some, supplements and pills, and all that was very important. So and the caregivers were kind of, responsible at a mealtime to make sure the pills were given and all that. So we had some rules about that, and then have fun. That's the, connect with her. And it's interesting because you could see some caregivers that had the technical part of caregiving down, like safety, make sure they didn't fall, but they couldn't make a connection, with my mom. And both were important. I wanted her to have her life be fun and enjoyable. And that's the whole purpose of working so hard to keep her home, to have her a nice environment. And the caregivers were really important to that. And
Not
so,
just be stuck in front of a TV all day.
Yeah, no. And so I had, rules about pay attention to her, have fun with her. And just, it's funny, within one shift or two shifts, the caregivers that had it, they were very creative. I mean, they did music, they played, music without me asking, they danced with her, they would, sing. And I didn't prompt any of that. I just said, have some fun. And they knew exactly how to have fun with somebody and how to connect. And then it's funny, for this interview, I decided to go back and call. The good news is the caregivers toward the end were with me for quite a while, which I want to talk about that in a second. But so I called a couple of them up on the phone getting ready for this interview. I said, I know what you did technically, and it was great, but what were you thinking about with this connection with my mom? How were you thinking? And they said, a couple of thoughts. One is never get frustrated. Always accept, the patient, the Alzheimer's patient, where they are at the moment. And never get frustrated. And you could see with just in retrospect, some of the caregivers, if they didn't do what they said, they get frustrated, and that doesn't work with Alzheimer's patients. You have to sort of make that connection, be unbelievably patient, like you would with a child, or somebody, with a problem. Don't contradict the person. Sometimes you have a tendency to want to be right with an Alzheimer's patient. No, don't contradict. Go with sort of where they are, and then you can kind of slowly get them to do what you needed them to do. You can kind of just sort of, it's almost like you roll with the behavior, and you agree, and you go kind of do what they want to do, and then you slowly, in a creative way, get them to do. And it's hard to teach, but some of the great caregivers have it. They said watch them and really learn them, because my mom lost her speech probably about the same time all these caregivers were coming to help.
Did she try to speak?
She did, but there was no words. I mean, that was one of her earlier symptoms. And her mind was still there, and she could, when you talked, she would understand for the most part, but she lost her speech. And so some caregivers would be frustrated with that. And that was not good. So the tip that one of the caregivers I called for this interview said, you have to really listen and get to know them for kind of who they are and what they want with no words. And it was remarkable when you really paid attention. You knew how to do that. You knew what they would want. You knew what my mom would want. You knew when they'd have to go to the bathroom. No words.
Interesting.
just behaviors and observations and connecting and listening, and just talk to them. The other thing was talk to them. If just because she can't talk back doesn't mean she doesn't understand. And it's good for her brain to listen and connect. And when you know somebody, her face would tell you that she's got it and she understands it
Did they read
without a
to
word.
her?
They read. They do drawings. My mom liked to do all that kind of stuff. She would love these coloring books, and she would sit there, and the caregivers would help her, and they'd work together. And it was just funny to watch as again, observed and was kind of part of this without, being the direct caregiver, many of the hours. But my mom, when I would watch them, and the caregivers would like color on the same drawing, and my mom would like not like the way the caregiver did the drawing, and she would like, with no word, just push the hand away, in a nice way. It's like, come on, you're messing up my drawing. But that's all part of just the connection, and that's as important as the safety. Safety is really important, and so is having fun and making this a good experience. And the best caregivers can do both. And so I'd encourage you to not give up. I mean, I had to go through a lot of caregivers, and I learned a lot about who to hire and who not to hire, just trial and error.
How many caregivers did you go through, Mark?
Oh, probably, oh my gosh, I don't even know exactly. But I would say in the beginning more, because I couldn't figure out sort of what worked. And then, it wasn't uncommon to, in the first year, I would go through, 10, easy. The good news is once I sort of landed on, it's almost like, you get the bell going, this is a keeper. And then my tip is for everybody is be unbelievably flexible to keep that person. Okay? It's like if they want a short shift, give them a short shift. If they want a long shift, give them a long shift. And that's also the advantage of having a few agencies. I didn't talk about that. I would say you got to have more than one agency if there's going to be a lot of hours involved. And my mom slowly ramped up hours, so it would be just a couple hours a week, and ended up being 24 hours for the last couple of years. Mm-hmm. And you've got to flex around the good people because you don't want to lose them. You work too hard to keep them.
Who was managing the shifts?
It was a combination. You have to work closely with the agency. They would work with the person, and you would kind of figure it out. How many hours you needed and what was important, and then you just kind of flex. And it was interesting because once I sort of locked in on the team after 2 years or so, and I just said, I'm going to do everything I can to keep these people, then it was remarkable when everybody has a personal thing, and I can't make this shift, my daughter's this, whatever, totally understandable. They would actually work with each other. They became a team. And one would say, I can't make such and such, and then they would check with, okay, can Alma fill in for me? And we would kind of make that happen. And they would know that, okay, I did them a favor, so they're going to do me a favor. And it was a beautiful thing.
They coordinated with
each other.
Nice.
I was like the quarterback, and I was kind of figuring it all out. But it was great because once I had this sort of caregiving thing down, I was able to focus on things like the doctors and the medical care and experimenting with supplements that I thought would help. And I could kind of be, managing the process and not, and I was always there. I was kind of working with them and partnering with them, but it gave me the freedom to help her life, be better.
That leads me into what I want to ask you about. It becomes more and more difficult, of course, to go to the doctor's office, the dentist's office, heavens, podiatrist, physical therapist, if you need that, even hair appointments. How did you manage those appointments, and at what point did you start to have those professionals come to your home?
Yeah, that's a great question. I would say at the point where I needed people to come to the house, which was, after probably 2017-ish, 16, 17, because it was just, I could always, my mom, even until the end, could go to the doctor, but it was a challenge. It wasn't easy. So in my head, I was going, I want to prioritize which appointments we go and which appointments we can get somebody to come to the house. So I wanted to keep her cadre of doctors. She had some sort of general medical conditions. She had a cardiologist, she had a neurologist, primary doctor. Those are doctors I didn't want to just give up, and they didn't come to your house. So I prioritized those appointments as we go to there when we need to. Now, the other appointments, like she had some physical therapy work, which, by the way, I'd suggest just to keep flexibility as an Alzheimer's patient, kind of progresses. That therapy helped with continuing her walking until the end and other things. So that can come. Physical therapists can come to the house. No, that's a no-brainer. Easy to do. Got to keep their nails short, toenails, fingernails. Another easy one. But it wasn't hard to find a podiatrist that would come to the house to do, cutting nails and just checking out feet and, that kind of stuff. Hair is another one. You can get your hair cut at home easily, very easily. And so this was like I would, slowly prioritize these things where it wasn't that hard at home to do these sort of non-specialized, kind of things. And how I get those names, it'd be, most of them came from the agencies. So I'd say, any good referrals on, a hair cutter that comes to the house. Sure enough, they did, and they usually are pretty good. And that's the advantage of a couple of agencies, because it wasn't uncommon for me to say, like, a hair cutter. One agency would, I don't know, but I'd call another one of our other agencies I work with, and they did know. So that's another advantage of having a couple of agencies sort of on the horizon. Later on, toward the end, probably in 2019 maybe, my mom started not being able to go to the dentist. So it's not uncommon, as I learned and read, Alzheimer's patients, like bite, and just have kind of some weird things around that. And so after one of the dentist appointments, at some point, I realized this is not going to work. And so I was surprised. I actually didn't think I could do it, but I found a dentist that would come to the house. I mean, a full-fledged dentist that can do any dentistry you could do in an office. They have the equipment, they have the machines, and it was actually surprisingly good. And this woman knew about Alzheimer's because she did this, and she was great both technically and connecting wise with my mom at home. So so this was kind of my my thing. I didn't, just backing up a little bit. I was committed to doing this at home. One is because I had experience with homes, and I understand completely why people go to facilities. There's lots of good reasons to send your loved one to a facility. But I had an experience with my grandmother the last couple of months of her life in a place, and I was not happy with it at all. It was my only experience ever with any kind of caregiving. And after that, I said, if I can do it, I'm going to make sure I take care of my mom or anybody else that I'm responsible for at home. and what I learned over time is there's nothing you can't get at home. There's nothing. You can get doctors, which we'll talk about in a minute. You get dentists. There's no service that's not available at home at all. Nurse, you name it, that you can do it. And it was like, I didn't know that when I started this journey, but I figured that out, as you go. And it's expensive, but this is why I would suggest that the listeners think about long-term care insurance. Now, in the beginning, it covered basically all of my costs. When I needed 24-hour care, it didn't. But the fact that it would pick up probably about half of my total costs was like, okay, I didn't have to worry about it now. Thankfully I had some, savings and all.
When did you get long-term care insurance, Mark?
Quite a while ago. My dad passed away very young, and so he was, in his late 50s. And so soon after that, I realized it would be good to get long-term care for my mom. And so she was fine and healthy. This was like she was in her early 60s when I got it. And I'm not going to talk about long-term care, but there's lots of different kinds out there. I would just do it. Research it, figure out which kind is best for you. There's a traditional kind, which is sort of pay by month, and there's a hybrid kind that's a combination of life insurance and long-term care. Anyway, I could go on for that, but that's something that you guys should look into. It's very important. But this idea of services, doctors, you name it, it's all available at home, and it's surprisingly effective. And so I kind of reserved the specialty doctors my mom had to go to the office visit.
Okay.
So to answer your
Okay.
question.
Yeah, I had a dentist come visit my mom, and it was a little scary for her at first, but then she got relaxed. The dentist knew how to handle people with dementia. And it's a good idea because should they have any tooth pain, they can't tell you. They just act out. They can't say my tooth hurts. So preventative dentistry is really a good idea.
And this lady that I chose was awesome. I mean, she had fun. She knew what she was doing, and it was all these experiences. If you get the right people, are not bad. They're enhance their lives, not take away from them.
Absolutely. Well, Mark, I don't know if I've ever spoken with somebody so organized as you on this. The details of at-home caregiving of a loved one with dementia. There's a lot to take care of. There's a lot to know. And I'm sure that this is very helpful to a lot of people out there. you've been very successful at it. You were successful at it, and it worked for you. It worked for you. Before we wrap up, Steve, do you want to add anything to what Mark has told us?
I'd like to ask Mark about what your journey was like yourself. What happened to you through this process? Obviously, I have a lot of admiration. Anybody who's been a caregiver and meets somebody who's cared for a loved one at home, hats off. I couldn't do it. But I've never really had a chance to ask somebody, well, what was it like for you? I know what it was like for me. Making the decision about community was terrible, but making the decision about keeping a person at home, keeping a loved one at home, what were some of the pains that you went through?
Yeah, that's a great question. Well, with a 10-year sort of caregiving at home, roughly, it's a journey. It changed based on different progressions of the Alzheimer's disease. But I would say, early on, it was really about, learning and figuring out things. And, but emotionally, it's tough because you see your loved one change. But it's almost like the combination, you really are emotionally connected with the person, you love them, but you're kind of the manager. And being an executive for my whole career, there's that part of your brain that says, okay, I'm going to manage this well, and I'm going to be a loving, caring person, and make my mom's experience terrific. Why? Because she took care of me. It's a little bit like that simple. She took care of me beautifully and raised me right, and I couldn't be the person that I am. And successful and all that without her. So it's turnabout time. But it's a tough journey. At some point I had to get some help, not just all this caregiving help and all this kind of services, but I went to a therapist and got some advice, some help, some just kind of processing through it. So I'd suggest, even if you have a good support system, which I ended up getting with outside help, that you still get the personal attention that you need.
Need help yourself.
Yes, you need help yourself. It's not easy, no matter. And the people which I can't even believe it, people that take care of their loved one at home for a long, long time without all the help that I had. I was so blessed with the long-term care and a beautiful career. I was able to do these things, but I know a lot of people can't. So especially if you're out there alone and you don't have a good support system or caregiving ability, then you've got to get help. Because again, in 2015-ish, after about 2 years of sort of being home and doing this all by myself, I said, I can't do it anymore.
I can't do it.
I can't do it. And I had to get the caregiving going, had to activate the policy. I had to get the support system. I had to go to a therapist at some point, because it's very, very challenging.
There's nothing tougher than being a caregiver.
No, it's hugely, physically demanding, emotionally demanding. I was, for that last year before I got the help, I was, sleeping in my mom's room because I had to watch her 24 hours a day, and not getting enough sleep and not being a good caregiver. And that's kind of the point. If you don't get help, you're not going to be effective as a caregiver at some point. I don't know who you are, even if you're Superman. So you need to get that network going.
Yeah, it's really true. Well, we can't thank you enough for joining us today.
Awesome. Thank you.
I feel certain we're going to have you back because I know you have more information to share.
Thank you. I would love to come back.
We want to do a podcast on safety in the home, things you need to be aware of in your home to make it a safe environment.
There's a lot of things you can do. I'm happy to come back to keep your home safe, because safety is, as you know, safety is number one. If you're not safe, there's not much that goes after that.
I have one more question. How do you think your mother felt about you?
That's a tough one. Well, it's a good question. I think she'd be proud of me. I think I took care of her really well. It's funny, being a high achiever, you never think you did a perfect job. We are high achievers. So, and we're not going to get into this today, but I made some mistakes at the very end in the hospital, and I regret that. But I think net, I did a great job, and she'd be very proud of me. I think she had fun. I mean, you could, even as in the depth of Alzheimer's, even the last 2 years, you could see her having fun with the caregivers, having fun with me. The creative exercises, she couldn't sing, but she would love to. She would shake on her walker like dancing. So she had a good life. So I think again, I'd never know because she lost her speech, but I think she would be happy that I helped her.
I think she would have told you you're a perfect son.
I concur.
Thank you to our listeners for tuning in today. And be sure to check back soon for more important caregiving topics on Spotlight on Care.
Spotlight on Care is produced by the University of California, Irvine Institute for Memory Impairments and Neurological Disorders, UCI Mind. Interviews focus on personal caregiving journeys and may not represent the views of UCI Mind. Individuals concerned about cognitive disorders, prevention, or treatment should seek expert diagnosis and care. Please subscribe